We're going to have one last speaker, then we're going to open up to Q&A. But it's Dr. Sanjeeb Shiram, National Physicians Alliance. He's a member of the American Academy of Pediatrics. He was one of the leaders of health reform too. But he's going to talk about what happens to doctors in regard to Medicaid patients if they cut the reimbursement rate. Will doctors see them or not? And then what happens to patients if they cut Medicaid? So thank you very much for coming.
Hi everybody. So I'm a general pediatrician and I trained actually at UCLA and now I'm practicing with Children's National Medical Center here in the district. I bring up the geography just because I think that in addition to hearing about the changes in the reimbursements, it's not only about how many patients physicians will end up seeing or not seeing, but it's also how those patients will be seen. I think that, as a parent, one of the worst nightmares that you have about going to the doctor's office, besides hearing that your child is ill, is actually feeling like you never got to actually, speak to the doctor. That you were kind of like rushed in, your kid's waiting, vitals were checked, you had doctor barely touches the baby, they say, okay, everything's fine, and then you're out the door. And that 12-minute visit is barely enough for a lot of these, hardworking parents who have to actually take time off from work to make this little 12-minute visit, and get all of their questions answered about their child. And, that actually ends up hurting the quality of that child's health care on an individual level. And then when you start to broaden that out to, populations, you end up having the kinds of health disparities that we see in places like California, where actually, if you look at youth in California, we're already at a minority-majority population, meaning that the majority of California's children, below the age of 18, are already dominated by minority groups. So we're looking, and then when you look at, minority health disparities, which I think many of you are very familiar with, the data is really, mind-boggling. You have a black baby is more, twice as likely to die as a white baby. Those numbers start to get a lot worse, if you start to break it down by neighborhood and district. And I can tell you that none of that gets any better by putting general pediatricians and doctors in this position where they can't hire more nurses, where they can't grow their clinic to actually manage huge booming cities like LA or DC or New York, where you have large numbers of minority and immigrant and new American kids who, really need more than just a 12-minute visit. And so I kind of point out that as much as, there's been a lot of great points made about the deficit and about how, there's a lot of economic implications, but as far as actually managing health disparities on a patient-to-patient level, there's a lot at stake here that actually, has huge long-term, ramifications as far as, having more and more of DeMontes and a lot more of these kids that are going to pop up in the news for no fault of their own. It's really that the adults around them, not necessarily their parents, but the other adults in their lives actually, kind of felt that, well, you know what, that 10-minute visit was about as much as we could spare for you. And that's, something that I think, we can do better than that, especially in light of the new health reform bill that just got passed. I think that, it's, so I'm not really one of those doctors who's trying to bemoan the reimbursement. I'm really trying to speak from a position of being a minority health provider and just trying to show another perspective of what Medicaid is doing or trying to do as far as bridging some of these gaps. I hope that's not taking up too much more of my time. All right, thanks a lot.